Hello, welcome to this video. My name is Christiana Mausiserum. I would like to talk about, certain tips or things that you can do to ensure the safety of your sleeping baby so that the baby does not die suddenly in his or her sleep. And that is a condition that is known as sudden infant death syndrome. So what is sudden infant death syndrome? So this is, the unexplained death. Sudden death usually occurs during sleep of, a seemingly healthy baby. So the baby had no medical issues. And it commonly occurs in babies who are below 1 year. Now, the sudden infant death syndrome, when it comes to this condition, the actual cause is not known. However, it has been associated with, defects in the portion of the infant's brain that controls breathing or respiration, and then arousal during sleep. So, and there is no guaranteed way to prevent sudden infant death syndrome. However, there are certain tips that you can observe in order to keep your baby safe, making sure that your baby has a safe sleep. The first tip is that always put baby to sleep on the back. Never put baby to sleep on the side or on the face. No, the baby can easily suffocate. And the next one is the crib, where or any structure that has been made for the baby to sleep on should always be kept free from loose beddings or loose linens, no pillows, no stuffed animals or these teddy bears. Make sure you tuck in the cot sheet or the linen, the bed linen, tuck it in neatly. And it's advisable to use firm mattresses, not the very soft ones, because that could also, the baby's nose can press against it and then suffocate the baby to death. So the crib should be free from any loose bed linens or stuffed animals. Put baby to sleep on the back. And then you should also share a room with your baby, but not a bed. So even though you are in the same room with the baby should sleep in his or her own crib in the room, or any structure, bedding structure that you've made for the baby to sleep on. This is because an adult can accidentally, roll over the baby. If you share a bed with the baby, an adult can accidentally roll over the baby and then suffocate the baby or cover the nose and mouth of the baby, and then which will suffocate the baby and the baby could die. Another reason is that the adult's bed is not safe for babies. Babies can easily get trapped and suffocate in between the mattress and the bed frame, or the mattress and the wall. So that is why you should never share bed with your newborn baby or your child who is below 1 year. So at least share a room with your child until the child reaches age 1 minimum. Then the next tip is that you should not overheat your baby. So don't wear so many clothing, wrap the baby so many cloth or linen. Make sure you are dressing the baby to match the environment, the temperature of the environment or the room. If you live in a tropical area, you may want to consider using this cotton bodysuits with very breathable fabrics. And with this, make sure you do not add any cloth again. So wear clothes that do not require extra blankets to cover the baby. Do not cover the head of the baby when you put baby to sleep. So please pay attention to those, so that you do not cause overheating. That can also kill the baby in sleep. And occasionally use the back of your hand, or if you have a thermometer, touch the baby's skin and feel for warmth or whether he's sweating, and then you adjust the room temperature appropriately, or the clothing. That's very important. Then you should also breastfeed. In fact, breastfeeding is shown or has been shown to improve brain development, particularly the central nervous system of the baby, which is essential for controlling respiration during sleep. So breastfeeding protects the baby from sudden dying suddenly in his or her sleep. Another one is that you should take note that this baby monitors and all these devices that are being marketed all over, researchers have shown that they are not safe and effective at preventing sudden infant death syndrome. So please do not put your baby in a different room, a separate room, and then rely on baby monitor. No, that is not safe and effective. The child should share a room with you, and then you monitor your child. And even if the baby is in the crib, maybe during daytime, and you are doing some activities, make sure the baby is positioned at a place where you can easily monitor the baby from where you sit, or from whatever you are doing. You are able to monitor the baby closely. If the baby is sleeping, occasionally, intentionally go and check on the baby, making sure the baby is well positioned and all that. Baby is safe and breathing well. That is very important. So please, let's pay attention to this. Do not just relax. Don't relax because you do not want to see your beautiful baby die in his or her sleep. This condition is real. Sometimes you just hear that, oh, they put the baby to sleep and then the baby couldn't wake up. So that is the condition known as sudden infant death syndrome. It's very common. So please protect your baby. Never leave your baby alone. Never carry your baby in your hand whilst you are sitting in a sofa, a couch, or armchair, and then fall asleep. Never put the baby to sleep in the couch. The baby can easily press his nose accidentally against the soft couch, and then the baby could suffocate and die. So please always put the baby in the crib and choose a firm mattress or a firm surface for the baby to sleep. It is very important. So please practice these tips, put these tips into use to protect your baby from this sudden death syndrome. So thank you, and please watch out for more videos. Bye.